Hello, everybody. Yeah, nice to see every one of you again in our Facebook Live once a week. Yeah, on every Wednesday. Okay, today's we will be having a very important topics, very interesting topics for discussion today. All right, welcome everybody. Okay, Judy. Yes, hi, Judy. Okay, welcome. Thanks for joining. Okay. So today's topic is more on filler. Yeah, for any ladies or guys even. Yeah, if you are wondering whether you need a filler but you worried after reading through all the information provided to you through the internet or Google's, you may feel anxious or you are not sure. Okay. Yeah. Today I can answer all your doubts and let you understand what is the proper principles of filler use in our beauty. All right. And for those who have done fillers before, if you have some problems which probably result is not satisfying, or you have some problems or complications after the fillers, yeah, you may also stay tuned with our talks today, and you will understand why, and you will know, yeah, how to prevent it and how to benefits you the most, and also how to actually use the fillers, yeah, to achieve, yeah, a very satisfying results. Okay. Sorry, excuse me. Okay, thank you for joining everybody. Good afternoon. Yeah, let's start our topics today. Yes. So I put my topics today as in fillers. Yeah. Don't simply inject. Okay. So it doesn't mean that you cannot inject. It is still a very important tools of treatment in aesthetic and beauty line. Yeah. So sort of like fillers, you can't get rid of it in the use for the purpose of anti-aging, for beautification, but how to use it in a proper way, and what are the research, what are the proven way, what are the evidence base here. Yeah, today we will be talking about all this, and to let you understand what has been used, or what have you been understanding all this, or maybe wrong. Okay, what you really understand about fillers probably from a wrong perspective. Yeah, which probably an older version or older perspective, which is not a current trend anymore. And then the current trend is not saying that, oh, it's because of trend, because of demand, then it become a new trend. But indeed, yeah, instead it's actually a new trend, because this is wholly based on evidence based, and also more on result orientated, or even more understanding, because more understanding about how a human face aging, and how the anatomical or all the structures changes during aging. So how fillers supposedly helps, yeah, to reduce the aging's features accordingly to how the facial problems or structure age naturally. Okay, so we will be talking about this so that you have a better understanding, or a proper understanding, I should say it, yeah, for fillers. Okay, so ladies and gentlemen, if you are looking forward for filler treatment but you are not sure yet, I wish that you can stay tuned with us throughout the whole 1 hour discussion. Yeah, after seeing through all the information, probably you have a better understanding or proper understanding. And also throughout this discussion, if you have any questions, yeah, I welcome you all to type out in the comment column. Then I can answer each one of your questions. Okay. Okay, so the topics is don't simply inject fillers. It's actually to let you understand, sometimes fillers before injection, the planning, the decision, the calculations, yeah, is rather more important, yeah, than just simply, okay, I want to inject filler, or I got a sunkening lines here, folds here, I want to inject. I wish to fuse up the volume, fuse up the hole. Indeed, our face is not working in such a way, because our face is not a static. Our face is a more dynamic condition. It changes with our facial emotion, our facial expressions. When we have any certain emotion, our facial change in a very dynamic way. So it's not a static module for the face. So that's why we cannot inject fillers just as per sunkening area per se. If you do so, probably the chance of sort of like creating non-natural looking is very high. Yeah. Okay. So let us start. Okay. So fillers don't simply inject is our topic today. Welcome every one of you who are interested to know about fillers and know about proper understanding of fillers. Okay. So first of all, is filler necessary? Since we are talking about this, is the filler something really necessarily in the beauty? Okay, the answer is yes. No choice. Yeah, but you have to say yes because fillers is was invented more than 20, 30 years ago for the reason because when we age, our body, our face, lost volume. So these particular features of volume loss on the face causes aging changes on the face. So because of volume loss, so you need something to refill the volume. All right. So fillers is the particular tools to refill the volume. That's why to tackle any aging problem on the face, volume replacement is important. Hence, filler is necessary. All right. No choice. Okay. But let's understand a little bit on how aging changes on the face. Okay, what changes on the face when we age? So first of all, starting as early as around early 20s or mid 20s, our skin starting to age by losing out the collagens. Yeah. So what you will feel is you starting to lose out some firmness on your skin when you touch and pinch on your skin. You feel your facial skin is less firm compared to when you are baby or when you are like teenage. Yeah. And when you hitting into late 20s, or early 30s, you may starting to have some wrinkles on your foreheads, around your eyes. Okay. Yeah. So these are all contribute due to skin losing out of collagen. Okay. So laxity. So the second stage of aging takes place when you're starting to have some facial volume loss. Yeah. So this may start as early as early 30s usually. Okay. But they are quite commonly seen when we are reaching about 20, early 20, sometimes also you starting to have some facial volume loss. But that particular age usually is a maturation, means you are mature and then your face becoming more adult looking. It's still nice, but when you are reaching about early 30s, then the volume loss on the face will starting to cause a person starting to have aging features, looks old. So what you will appreciate is you will slowly losing out all the smooth contour on your face, and then the facial expression changes. So when you smile, when you talk, when you give any facial expression, it looks older. Yeah. So that's why your face can tell the age. Okay. And then the smooth contour, like let's say the angle when you take photo, side angle here is not so smooth, compared to when you were younger. So all this, when you're starting to notice on your face, it means that you are starting to have some fat volume lost on your face. And then, another kind of aging changes is ligament loss, which the ligament on your face is becoming looser and saggy. Okay, partly due to volume loss on the face, but at the same time, the ligament will lose up the tensile strength. Yeah, ligament fixation point on our face is quite similar to every single one. Yeah, is usually around here. Here we have a sort of a line of ligaments around here. Okay, so here and also here. So that's why those are the fixation point on our face. Okay, so whenever you move, you can't really move the skin from here to here because there are fixation point in between. So those fixation point are contributes from your ligaments fixation point, but this ligament also will age. Yeah, so the changes on the ligament will become a little bit loose, yeah, and also not so firm, and it's starting to sag down due to the gravity pullings, and then the volume loss on top of it will further contribute to the ligaments structure, yeah, to become collapsing. So then you will see the face become saggy. So this is part of the aging. And the last one is shrinking of your bone. Okay, so when the bone on the face, particularly around our mouth and also around our eyes, yeah, contributes, yeah, to sunkening around our eye. Okay, when we age with some bone shrinking, then the eye socket become deepened, yeah, and the lines on top of the eye become deepened, the tear trough, the eye circle, the eye bag will become obvious, and the sunkening around the bone of your oral cavity will cause deepening of your nasolabials laughing line, deepening of this mental crease, yeah, deepening of this malleolate line, yeah, and also sagginess of your buccal fats. All these are contribute to volume, bone volume shrink. Okay, so you will look older, older, and older in this sense. Okay, so you see, there are many changes on our face when we age, and each respective problems has its own treatment to target particularly. But at one point of a phase aging, usually these factors are all happening together. So, but we need to decide which is the most significant one, and which one is the most problematic one that you need to treat to improve your look. Okay, so if you do have a significant volume loss, then filler is the best choice to improve your overall facial beauty and look, right? Okay, so this is the simple idea to let you understand why sometimes we choose filler, sometimes we choose laser, sometimes we choose botox, sometimes we choose some collagen treatment, things like that. It depends on the aging changes factor, which percentage you have, which proportion you have most. Yeah. Okay. But it doesn't mean that you just need to do filler and the rest you do not need, because fillers probably is prioritized. You may need to do first, but the rest of the problem, if it's still there, definitely it will be there. Yeah. After filler treatment, then you can prioritize the second option, and then the third and number fourth. Yeah, whichever there. Okay. So this is how the priority of treatment choices you should go. Okay. So then, because of facial volume loss is one of a significant aging changes, so that's why to target this problem, fillers is a must or a necessary tools. Yeah. Okay. Of course, whenever you come across internet, social media, you will see a lot of these kind of features. People has been doing fillers, yeah, and the face looks weird. Okay, weird looking, and then you will see overall some of the celebrities is supposed to looks beauty when the person is young, but when they get older it's supposed to age gracefully or nicely also, but then the face changes. Sometimes you come across this word like pillow face, or flower horn face kind of thing. Yeah, so weird looking, but you can't really know where is something wrong. Yeah, because our eye has a beauty side of like and analysis ability by itself, but your brain probably can't really figure out. Okay, but your eye can sense it. So this is how that's why when a person did a filler, you know something done, but something not right, but you can't really see. So this is a problem. But from a medical point of view, we need to be more analytically. So we need to analyze, where are the problems, and what causes those. Okay, so you see, fillers over injection or wrongly done, either overdone or wrongly done, actually both condition also possible, which contributes to this unnatural look. Okay, so you see, these are the celebrities which looks beautiful when they are younger, which looks beautiful when they are younger. But the thing is, when they're getting older, they probably have had something done on the face, but then something not really natural looking, right? Okay, so and even here also younger it looks nice. Yeah, this was like younger looks nice, but when get older it looks something pillow kind of face, more puffy. Yeah, and I believe every one of you in Malaysia, yeah, who have came across some you know who, then you will say, hey, I don't want to look like her, things like that. Okay, so yeah, Judy Tan said people not even realize their look are weird. Sometimes the person herself do not realize. Okay, because sometimes when we look at our beauty, we look at lines only, we look at folds only. Yeah, we want to disappear. We want to sort of like erase the fold and lines. So if you wrongly do, you try to over inject a volume over the fold or line, and eventually you meet what you want, means you reduce the lines appearance, yeah, or fold appearance, but you thought it's nice, but from an overall look you look weird. Okay, you probably do not realize, but somebody else look at it, he realize. Yeah, so the problem is actually due to we call it overfill syndrome. Is where if you overfill your forehead, then the volume of forehead will become too obvious. Yeah, you will when you overfill the cheek area, upper cheek especially, then you will have this sunset eyes, cheek man, cheeks. Yeah, and if you inject on your nose, then your nose will be like a bit broad and avatar look. Yeah, and then if you inject the lips also, yeah, it looks very beautiful after fillers. But the thing is, if you do it accordingly to those social media, YouTube, people showing how they inject fillers, most of the time we saw is like, oh my god, yeah, things like that. So it will easily cause duck lips or sausage lips, because if the injection technique is not correct, then and somehow if the filler's choice is not correct, then you will easily have this kind of overfill syndrome. Yeah, and always I have patients telling me, yeah, they don't want to look like this wish chin. It's actually chin is not in such a way when you over inject, then you will have this kind of feeling. But to improve a facial appearance on the face, on the short chin problem, it needs a techniques, it needs skills, it needs knowledge to analyze, to plan, yeah, then also to execute the fillers safely and effectively without causing this wish chin. Yeah, so these are the things that we need to look into. Yeah, okay. So for female, you see, yeah, these are the weird looking. Okay, people thinks sometimes people knows is something wrong, but people don't know where it's wrong. Okay, all right. So these are the even for male also. Yeah, okay. So then you also have this kind of features. This is young, good looking. This is overfilled. Okay, then normal if you are not doing anything, you probably looks old, but this is what we want to achieve, good looking improvement, but we don't want to overshoot. Okay, so these are the important things. But whenever you see people do, you notice this, sometimes the person itself also don't realize. So these are the things which problems in the society, or stigmata problems. So we should address this issue. Okay, so since we notice this problem, and today I would like to introduce you all how a fillers being used professionally, and also based on evidence base. We call it filler myomodulation. Simple to say is fillers actually acts as a muscle interaction, improvement, and coordination. So what does it mean? Because on our face, okay, whatever fold sunkening that we see, it actually contributes from volume loss and also due to your muscle dynamic changes, your muscle behavior change, your muscle movement change. Okay, why it change? Because your facial volume change. So meaning to say, when the facial volume change due to aging, it will show up the effect of volume changes by muscle behavior, and then it appears as folds, and your facial expression will change also. So by analyzing the facial expression and also folds accordingly, then we will be able to determine which muscle group changes And then that particular muscle group changes is due to which compartment of fats on the face that is actually shrink or need to be volumized to improve. Yeah. So this is how analysis is very important. It's not that you have a folds there, wherever then you inject onto the folds and then the fillers done the job. No, that is totally wrong. Because if you understand the whole thing, sometimes the folds is, let's say, laughing line, the fold is here, but the problem is on top here. So if you inject here and the problem is on top here, first, you do not serve the purpose. And probably when you inject here, you will overdo the filler. You will inject filler more than what suppose it can tolerate, and then you cause overfill syndrome. So this is a very common thing people go wrong. Yeah. So fillers is a necessary thing and it has its way, but the thing is we need a lot of training, a lot of skills and experience to be able to analyze and to justify and to plan the fillers. It's not that, oh, you have a hand, then you can hold the filler, then you can inject. No such thing. Okay. Yes. So ladies and gentlemen, okay, so for example, yeah, let me introduce you and analyze accordingly. You see, let's say if you are concerned about this laughing line, yeah, and also some malleoline lines, okay, probably you are thinking, oh, your friend did fillers very nice, but you don't know where she injected, yeah, or where did her inject on her face. And the doctor do good job, but you do not know. Yeah, you thought the fillers injected just over this sunkening, simple idea. Think logic, just inject here, but answer is wrong. Okay, the problems here, the laughing lines is here, but the problem is over the cheek and also the upper portion of your lateral or side of your cheek, which the volume loss causing the sagginess of your ligaments, and then the ligaments, yeah, sacs will cause your facial expression to become more aging. So you have a static lines, and when you smile, the lines deepen, and then we see your cheeks move very easily. So these are the signs of your volume loss on top here. Okay, so we need to see how your in person, okay, how your cheek moves, how your eyes moves. Yeah, if your cheeks have a lot of movement, when you smile, the whole cheek comes out. Wow, nice. But when you don't smile and no facial expression, your laughing line is very obvious. That means the sagginess is on top here, not lower part. Okay, it's on top here. And then if your smiling also carries a lot of wrinkles around eye, then it also means that you have a lot of volume loss around the ligaments here, and the laxity of ligaments here contributes to the sagginess and causing your laughing line. So these are very complicated. You need a lot of training and experience, but the thing is, this is what fillers supposed to be used accordingly and to evidence-based safely and effectively. It's not that you inject directly on this point, because if you have sagginess on top here and here, and you inject these fillers here, and you will further heavy or burden the volume over the lower part, and the ligaments will sag even more. So people been saying, or after inject filler, you will feel that the filler dislodge, displace, yeah, it is dislocate to other place, and then the face will become even heavier. It's because you do not analyze and then you inject wrongly. Okay, so these are the thing. Okay, so ladies and gentlemen, if you have this problem, if you tackle properly on top here, okay, yeah, and then improve your cheeks, okay, accordingly safely, then you can see the line improve naturally. Okay, so these are the proofs, yeah, evidence-based study cases, things like that. Okay, even from the side you can see, yeah, uneven jawline and obvious, okay, necklines, okay, and also fold over your laughing line. Okay, so same thing. Okay, this is because of a ligament laxity over the jawline here. So the problems has been tackled, and then you can see the lines improve here. Okay, and also firmer. Okay, of course, the volume injected can be even more optimized to get this result even better. So, but conservative also one of a way that we encourage patient to do. If you do one here, then after that, if you see improvement, you know the direction is correct, and then you can further enhance more. Okay, yes. So you see from the side, yeah, very obvious improvement here compared to this one after, yeah, and the jawline also smoother. All right. So these are the clue. These are the things that we need to see. So people's fillers can be done very professionally and also safely. Okay. One of the things sometimes we feel sad because my some patients may have seen some people done fillers and they thought fillers, oh, that's the way. And when they come to me, they say, oh, fillers, I know a lot of things, but indeed they don't know anything. Okay, because they do not know what is the correct things. So they just saw all the old and wrong things. Okay, so and they miss out the good chance or good way to improve their beauty, because aging sometimes definitely fillers take up a big portions. Volume loss on the face is a big portion of aging. Some we do see a lot of people who have volume loss more significant compared to ligament sagginess and also bone resorption. And indeed to say, facial fat volume loss is the commonest problems on the facial aging, second to the skin laxity, lack of collagen. So these are the things that it makes the filler is so important and necessary. But sad to say, yeah, many people do not really understand how fillers done, and sometimes they regard fillers as in those causing overfill syndrome, and very sad. So but anyhow, okay, my purpose today is to share with you all more on this proper understanding, so that you can understand how fillers is properly used and then how it benefits you the most. All right, okay. So these are the effect of fillers injection. Okay, before and after, you can see, yeah, laughing line better, the wrinkles around the lips also improves. Okay, so if you do it right, yeah, so the result will be very nice and very natural. And indeed, this patient do not inject fillers around this area. Okay, the fillers are inject on the upper portion of the cheeks and also lateral side cheeks here, yeah, to improve the ligament supports. That's it. Okay, so yeah, another scenario, yeah, double chin, wrinkles over the necks, yeah, short chin, laughing line, and also malleolin line. If you understand, the problem is actually due to the sagginess over this ligament and droopiness of the fats here due to the sagginess of this fat compartment and also upper cheek compartment. So what we did, okay, filler injected, and then it improves the jawline, okay, improve the laughing line. Yeah, so this is how it goes. Okay, see the laughing lines, yeah, the jawline improves, very beautiful. Okay, so and the result is natural. You look at this, it looks very natural. Because why? Because the fillers injected was accordingly to what the volume on each particular compartment your face supposed to be. Yeah, it's not over injected, but we need to inject an adequate amount, and this is based on experience and studies. There are calculations that we need to know where to inject, what to inject, and how much to inject, and to serve the effect thoroughly. Okay, so this is the fillers, yeah, method. Okay, so even for guys, you can see sunkening here, and also laughing line, and also malleolin line, and also some double chin effect. Okay, same goes to the lines here is because of loss of volume over this compartment and buccal fat, and then the sagginess over the ligament due to this upper portion of the ligament and also around the eye. So when we inject the fillers, you can see the eye improve. Okay, yeah, the lips, yeah, the chin, the sunkening lines also lessen, the jawline also becomes stronger. All right. So any questions so far? Yeah, before we further go on, yeah. Okay. So filler is not scary. Filler sometimes I would say scary is because you wrongly choose. Yeah, you wrongly choose the person to inject for you. Okay, simple to say. Yeah. Okay. Or you do not really understand your problem how to treat. So sometimes fillers people been saying, oh, you inject, then just inject here lor. You thought, oh yeah, 1 cc Caltin, done. Okay, but indeed your problem is not 1 cc Caltin. 1 cc rather I would not recommend you to do, because sometimes it worsen your problem more than helping your problem. Okay, that's why my topic today is don't simply inject fillers. Injecting not proper amount of fillers sometimes is worse, than injecting more volume of fillers. Injecting 1 cc or less in a wrong area is worse compared to injecting a lot of volume but in a proper way. Okay, so injecting a lot of volume but in a proper way is safe, 100% safe. But the thing is, if you inject wrong place and over inject, 1 cc also can cause you a lot of problems. Okay, so these are the things that we must get it right. Okay, very sad, Malaysia sometimes knowledge information is a bit slow. So but I hope, every one of you here, who are joining us, thanks for joining, and I hope you can share to all your friends, your relatives, or your buddies, so that they get the chance to know more about the fillers. So and then the important is the proper techniques of filler injections. Okay, volume calculation is very important because each areas of the face has its natural amount of volume it can sustain. So you cannot overstretch it, you cannot overfuse it, you cannot underfuse it as well. So to give the improvement on your facial aging problem, so then we need to inject the optimum volume. We call it optimum volume of fillers so that it serves the purpose, and it does not cause additional problems. Okay, so this is a problem of this sagginess, eye bag, so this is due to the ligaments, here, which is lax, this is the problem where the skin is losing out collagen, and also at the same time the ligament is sag, and also bony resorption. All right, so you can see around the lips, they are laughing line very deep because of volume resorption, and also around the eye also because of eye bags protrusion. So they are sunkening, bone shrinkage, and also the facial collagens are also become less and droopy. Okay, you can see here and side here, and the skin also losing out a lot of collagens, and the cheeks is actually also losing out volume, and the temple as well losing out volume. Okay, so the problem is over the ligaments here, the volume loss around the upper portion and side portion of your cheeks, and also side portion of your uh, we call it cheeks, and also the temple. So by volumizing this area with fillers, these are the result that we see. Let me show you. Oh, so this is before, this is after. Okay, so yeah, okay, so you see the after. Okay, so because the skin laxity is still there, so you still can see some skin laxity, but the overall appearance of your eye, the eyebrow, the eyelids, the contour of the eye, the contour of your cheeks is actually smoother after the fillers treatment. Okay, so very natural looking, refresh effect. The person after fillers looks freshened, refreshed, and it's not weird looking or overfilled. So why they are get many cases overfilled still? Because no no proper techniques, no proper calculations, no proper use of volume. So all this it really based on our research and also studies and experience. Okay. Hey, share more cases like this is a short chin, with laughing line, Malayalian line, deepening wrinkles over the chin, and also short, jawline. Okay, so the problem is here. Okay, so when the patient do facial expression, you can see patient have a sort of sad looking, very deep lines here, and also a lot of wrinkles, and double chin is very obvious. So all these are the features that we look at, and to determine whether the ligaments around the jawline is it firm or not firm, or need to volumize on which part to support the ligaments. And then after the treatment is carried out, okay, you see this before, this is after, so okay, the effect is nice. You can see more refreshed and younger look, and no witch looking. No witch, no, not like, a chin is very sharp and looks like a witch. No such thing, right? Okay, so Okay, eye area also, yeah, sunkening, the eye circle, tired looking, sunkening around the upper eyelid, lower eyelid as well. So the problem is this volume loss here and here, yeah. So the ligaments around the eye is very lax. Okay, after fillers treatment, okay, you see the sunkening become better, yeah. Sunkening over upper lid and lower lid also better. The eye looks fresher, yeah. No so much of droopiness, no so much of the eye circle appearance also looks younger. Okay, yeah, even the eyebrow also looks nicer. Okay, so these are the thing if you do it correctly, and the result is very natural, no overfill syndrome. Okay, then yeah, short chin, you see the facial expression have a very deep mental crease, yeah, and also buccal fat is obvious, very wrinkly chin, contour rounded face. Okay, after injected fillers over the chin and myomodulation improves the muscles behavior, the smiling, when the lady smile also, she looks prettier and more attractive. Yeah, the chin is nicer, the lips also looks nicer, and the cheek also looks better and younger. So she's not only more attractive, she's also younger, more energetic, yeah, and more sexy looking as well. Okay, so filler calculation, filler justification, all very very important. Yeah, okay. So Judy Tan say, filler is not injected into laughing line only. Yes, you are right. Yeah, we need to justify where is the main cause of the laughing line, because out of 10, yeah, out of 10 people, maybe 3% have bone resorption. That's why you need to inject into a laughing line. 5 out of 10, 50% probably the problem is over the cheek area. 2 out of 10 is due to the skin laxity. So it's different, totally different. You cannot use the same technique to treat everyone's problem the same, right? So, okay. Then, yeah, so this is a young lady, yeah, looks beautiful also after filler injection, even more beautiful. Okay, she looks very natural also, does not look like overfilled. Okay, and she injected about 6 to 7 cc of fillers after this, so she looks even more beautiful. Why is she so? Yeah, the chin sharper, the jaw is nicer, the face is more V-shaped. Yeah, so this is her face. She looks more beautiful. Okay, so you inject 1 cc wrong, everything wrong. If you inject 6 cc, 8 cc correct, everything correct. Okay, so these are the things. All right. Yeah, so this is also before and after. Okay, the contour is nicer. Yeah, the chin is sharper, and the overall facial look is better. Expression is better. Emotional is also looks happier, not so sad looking. More energetic, not so tired looking. Looks younger, not so old looking. Yeah, looks firmer, not so saggy. So you see, proper injection of filler based on proper volume calculations is very important, and a proper plan is very important. It's not only letting a person really able to benefit the fillers effect, but it also prevents a lot of unnecessary outcome, which is particularly the overfill syndrome. So proper injection of fillers also makes the result even more lasting, and it is not only improves the static appearance on the face, but it also improves the dynamic portion, means the patient facial expressions when the person smile, cry, talks, yeah, angry, whatever. So the person will looks younger, yeah, more attractive and also younger. So this is what's supposed to be the fillers function. Okay, so this is why the fillers is different use for current perspective compared to before. The changes and the improvement is totally due to because of a lot of research studies, proven studies, and also a lot of evidence based, on how a facial loss volume during aging, and how the proper justification of volume re-injection into a proper volume compartment will improve the face in a very natural way. Okay, so you see before after she looks, sharper, yeah, and also the contour nicer, lesser lines, and also the facial expressions looks younger, more attractive, more beautiful, right? Okay. Oh, thank you. Yeah, so far up to here. So summary to say, okay, summary. Yeah. So fillers, okay, is necessary in the market and necessary for the use for beauty anti-aging is because our facial do have facial volume loss when we age. So you cannot ignore this part if you want to improve your beauty look or to sustain or maintain your look. So sometimes we do see a lot of people, even they are young, early 20s, they born with certain not adequate volume on the face. In particularly, they have tear tooth problem, laughing line, or short chin. So this problem can be addressed properly by putting fillers in the appropriate compartment on the face with proper calculations of volume to be laid or to be injected, and then it improves the whole structure and makes a person looks younger, looks better, yeah, looks more beautiful. But at the same times, what really the person's or the patient's benefit is it prevents those problematic area from further aging. Means that if a person who have short chin, she probably have a more tendency to age over her lower face younger than other people. So meaning to say when we inject fillers, it supports well. So then she delays her aging over the chin. Yeah, which supposed to age early if she has short chin. If she has dark eye circle at early 20s, means she already have a very weak point around the ligaments and fat compartment around the cheeks and eye, that makes her age faster than other people. Yeah. So that's why when we do fillers, the fillers not only justify and also rectify the current problem for her, makes her looks more beautiful and more attractive for the current moment, but it also makes her, yeah, prevents sort of aging over the eye area. It makes her eyes actually age slower than what is supposed to be if she do not do the fillers. So these are the benefits on top of all the rest of the benefits. Yeah. And if you do the fillers right, you are not only avoiding all the unnecessary complications like the filler running here and there, shift praise, or the filler feel lumpy, or a lot of swelling after treatment. You are not only avoiding all these unnecessary side effects, but you also prolonging the durability of the fillers. Which fillers usually we use hyaluronic acid fillers because hyaluronic acid fillers is so far the safest and most integrative fillers, which it blends well with our tissues without any side effects or interactions or sort of like rejection, and it doesn't cause any sort of chemical retain in the body that causes any side effects. So fillers of hyaluronic acid is one of a golden or good choice, but the thing is these fillers do not last forever. Okay, in study it lasts about 1 year to 2 years, but if you do it in a proper way, proper calculation, proper compartment, the end result lasts longer. Okay, yeah, even longer than 2 years. So this is how fantastic. So and it just need a proper tannings of fillers and calculations to plan properly, and when we carry out, we can carry out all the plan accordingly without any doubts. When you are not doubting your injection, you are not guessing, and you are not like half inject half see, where to inject. It's like intuitive in that way. It's more likely to cause side effects if you do it in an intuitive way. You should do it in a planned way, everything planned properly, everything in and out done. When you carry out, no doubts, carry out all in a plan, then you will see the result fantastically. Yeah. So this is how facial problems can be tackled using filler. Very safe, very effective. But the problem is we do see a lot of people have different perspective of understanding about fillers. They thought of fillers after filler injection, it will cause uh, puffiness over the cheeks, sun setting eye, yeah, and also flower horn, sort of like forehead, very witch-like chin kind of thing. This is wrong perspective. Yeah, nobody who are good to do who are skillful to do fillers do such a thing. If you do such a thing means the person injector is not skillful. It's just a person that can have a hand and carry the filler and then inject. That's all. Okay, so that is considered anyone also can do, but it's not skillful. Okay, so I have to be honest. I did sorry if I sort of like pak cui anyone. Sorry, but this is the truth for the benefits of our customer, client, and also the consumer. All the consumers should know this. Okay, all the consumers should know this. If you are afraid of the fillers that causing this problem, you are right. Okay, you should not do all these kind of techniques. Then don't follow all the internet shown technique. The techniques that learn from internet most of the time is also causing this problem. Okay, so fillers has to be done under a proper trained professional. This is again, I need to emphasize again, proper trained professional who are skillful to understand your facial compartment, to analyze where is your problem, where are the compartments has a volume loss significant that need to be inject, and what to be inject, how much to be inject, and how to inject step by step, plan and done. Okay, so this is the filler's perspective, which supposed to be correct for all of you to understand, to get to know. Because one day if you want to improve your beauty and to enhance your beauty or prevent your beauty from aging, then you may still need fillers. Why? Because our facial volume loss is one of the definite problems when we age. So you cannot run away from volume loss, right? So you definitely will have volume loss. You can't do anything to prevent it. No collagen taking, no facial, no laser, no skincare can prevent volume loss. Volume loss just happen by itself. Nothing else can be done. Okay, so that's why volume loss is a significant problem that will cause any impact on your face and making aging. And then when you want to prevent those problems of aging due to volume loss, you may need filler. Okay, so fillers can be done in a proper way, not a wrong way. Okay, and for your understanding, yeah, at the end of the day, you still can choose not to do filler. Yeah, we respect and we do not force or sort of like psycho anyone to do fillers. But if you think that you are having a problems and the problems you feel eager or you feel like necessary to treat, and I will suggest you the most appropriate treatment accordingly to a problem. And if your problem is definitely a volume loss, or significantly due to volume loss, and the most significant impactful treatment for you is filler, then I will suggest you to properly understand about filler in such a way, and then you will know and you will feel more confident to do filler. All right. So again, thank you very much to everyone who just joined and also who have joined us since beginning until the end. And very grateful and also gratitude to be able to share my knowledge or informations and experience to every one of you here in our Facebook Live. Again, I hope that I have a chance to share more information on every Wednesday, Facebook Live, okay, and to meet every one of you online here. Okay, so if you have any particular requests, questions, you can drop us the message either now or later. And if you are interested to know about fillers or for your beauty improvement, yeah, you're welcome to visit us in our Revival Clinic here in Kota Komuning. And also, okay, you can call us by phone 017-781-5237. Visit our website or send us an email, yeah, to know about to contact us or to know more about fillers or for your beauty improvement. All right. So thank you very much again to everyone. Yeah, and I'm very happy to be able to share information with you all every Wednesday here in our Facebook Live. And I wish you all happy Wednesday and live beautifully. Thank you very much. Bye bye. Okay.